Published by WordPress.com. Congenital hand conditions. Cleft hand. Absence of one or more central digits of the hand or foot. Management. Mild cases, observation and hand therapy. Severe cases, surgical reconstruction to improve grip function, e.g., deepening the first web space, finger transposition, or centralization procedures. Prosthetic or adaptive devices for functional support. Absence of one or more central digits, central deficiency. Management. Functional assessment is key. Mild cases may not require intervention. Reconstruction via soft tissue procedures, toe-to-hand transfers, or prosthetic use if functionally limiting. Symphalangism. Congenital digital stiffness. Management. Non-surgical. Physiotherapy, splinting, adaptive devices. Surgical. Limited success with joint release or arthroplasty, indicated in severe cases for function improvement. Camptodactyly. Congenital digital flexion deformity, typically affecting the pip joint of the small finger. Management. Mild cases, less than 30 degrees, splinting, stretching, physiotherapy. Severe cases, greater than 30 degrees or progressive deformity, surgical release, flexor tenotomy, joint release, or tendon transfers. Clinodactyly. Congenital curvature of a digit in the radio-ulnar plane. Management. Mild cases, observation, splinting if needed. Severe cases, angulation greater than 30 degrees or functional impairment, wedge osteotomy to correct deformity. Syndactyly. Failure of digit separation. Management. Surgical intervention, between 6 to 12 months of age. Z-plasty or skin grafting to prevent web contracture. Avoid simultaneous release of adjacent fingers to prevent vascular compromise. Post-op care, splinting, physiotherapy. Poland syndrome. Unilateral chest wall hypoplasia. Hypoplasia of the hand and forearm. Symbrachydactyly and shortening of middle fingers. Management. Chest wall reconstruction with muscle, tissue flaps if significant. Hand reconstruction, web space deepening, tendon transfers, if functionally limiting. Prosthetic augmentation if severe hand hypoplasia. Apert syndrome. Bilateral complex syndactyly of hands and feet. Management. Surgical release of syndactyly, staged approach. Multiple reconstructive surgeries for function and cosmesis. Craniofacial and skeletal interventions as needed. Polydactyly. Preaxial polydactyly, thumb duplication. Postaxial polydactyly, small finger duplication. Central polydactyly. Polydactyly, extra digits. Management. Preaxial, thumb duplication, surgical reconstruction, excision of extra thumb, soft tissue balancing, ligament reconstruction. Postaxial, small finger duplication, simple excision for small rudimentary digits. Complex cases may need soft tissue, bone reconstruction. Central polydactyly, middle fingers, complex surgical reconstruction to preserve hand function. Macrodactyly. Non-hereditary congenital digit enlargement, local gigantism. Management. Non-surgical. Observation if mild. Surgical. Epiphysiodesis, growth plate arrest, in growing children. Soft tissue debulking or ray amputation for severe cases. Nerve decompression if associated with nerve overgrowth. Constrictive ring syndrome, Streeter's dysplasia. Amniotic band syndrome leading to loose fibrous bands of ruptured amnion adhering to and entangling developing fetal structures. Management. Mild cases, monitoring if no functional impairment. Severe cases, surgical Z-plasty or excision of constriction bands to prevent vascular compromise. Amputation in extreme cases where circulation is severely affected. Thumb hypoplasia. Congenital underdevelopment of the thumb, often associated with partial or complete absence of the radius. Management. Type 1-2, mild hypoplasia, ligament reconstruction, tendon transfers. Type 3V, severe hypoplasia or absent thumb. Pollicization, index finger transfer to create a functional thumb. Thumb reconstruction, bone grafting, soft tissue reconstruction. Congenital trigger thumb. Abnormal flexion at the interphalangeal, IP, joint. Management. First line, splinting and physiotherapy, for mild cases. Persistent cases, greater than 1 year, surgical release of the A1 pulley, trigger thumb release. Congenital clasp thumb. Flexion-adduction deformity of the thumb persisting beyond the 3rd or 4th month of life. Management. Mild cases, less than 4 months, passive stretching, splinting. Persistent cases. Soft tissue release or tendon transfer, e.g., EPL or FPL reconstruction. Surgical correction if severe or functionally limiting.